Hi, my name is Ruel Abcede, and this reflection focuses on our discussion last March 20, 2025, led by Julie, our instructor, and we discuss about the principles and the practicality of motivational interviewing and trauma-informed care in application in therapeutic nursing. So one that struck me most is that the approaches are not used for us to become or to turn us into therapists, but rather than it's about the communication with intention and awareness. It's about how we respond, how we react, and how we show up. So our tone of voice, especially, which is calm, non-judgmental, and curious, could regulate those emotional disturbances of our consumers wherever we work, whether in the acute inpatient ward or alcohol or the drug community setting. That is very important. So I also found out that motivational interviewing is related to the stages of change. People are not yet ready to change. They're not yet in the contemplation phase. So we cannot say that non-compliant, but they're just not ready to change. So we cannot also say that the ambivalence is a barrier, but it's part of the process. So we need to understand, read the room, we need to regulate ourselves and respond flexibly, especially when the agitated and aggressive client we respond in any setting. And also found out that you know restrictive interventions can still apply the motivational interviewing in a therapeutic way when done with empathy. For example, when reviewing in the seclusion, there's a consumers there, and we explain, we ask for consent, we validate their feelings in a short period of time because we don't have that lengthy luxury of lengthy conversation. So that would be the turning point, whether they will create a trust or re-traumatize or reinforce trauma. And also it's based of their cultural background, their trauma history, their cognitive state. For example, those consumers might respond strongly to authoritative tone or closed door discussion, and those people having some withdrawals may also have some kind of difficulty or struggle in focus. So we need to adjust how we engage, our pacing, and we need to respond flexibly. So again, this trauma informed and recovery focus approaches clients or consumers in a nice way. So we as clinicians, we need to have some self reflection, debriefing, and also this approach or utilize team support whether we're in line with the principles of mental health well-being act, because we could re-traumatize or you know um, bring back or having this flashback or ruminations of the past negative experiences of the consumers. So we need to have this strong presence, humility, and genuine interest to the client, especially empathy. We need to have that empathetic milestone. We need to have this good eye contact. We need to have these open gestures because they will know our nonverbal cues. We should have this respect and flexibility because there's no individuals or there's no two individuals respond the same time. They're unique. So it depends on the situation, and this is not a script. The motivational interviewing and the trauma informed care are not a script. We need to adjust and apply in real time. So hopefully I will really apply this kind of approaches regularly despite of not labeling and not knowing it, because it would really help the consumer recover faster in an ethical way. So Thank you so much for listening.